Hello everyone, welcome back to my YouTube channel Dr.Barki's Ophthalmology Tutorials. Today we will discuss about the course of oculomotor nerve. In this video, first I will give you the overall picture of the oculomotor nerve, like from where it arises and how it courses further. Then we will divide the oculomotor nerve into various parts, and then I will brief about each part, followed by some information about the pupillomotor fibers. Then we will see various causes for oculomotor nerve palsy depending upon the position of the nerve. So this is the overall picture of the oculomotor nerve. So here we have the nucleus of origin of oculomotor nerve, followed by its course in the midbrain. Then it will leave the midbrain, and then the oculomotor nerve will pass between posterior cerebral and the superior cerebellar arteries, and then enters and traverses through the cavernous sinus. Okay. After that, it will enter into the superior orbital fissure and then enters the orbit to supply the various extraocular muscles. So as you all know, the oculomotor nerve has two components, means it has both the motor fibers as well as the parasympathetic fibers. The motor fibers will supply the extraocular muscles like superior rectus, inferior oblique muscle and the medial rectus muscle. Whereas the parasympathetic fibers will supply the sphincter pupilla muscle as well as the ciliary muscle. Okay. So this is one more picture which is showing the course of the oculomotor nerve. Here you have the oculomotor nerve nuclei which will pass in the which will travel in the midbrain first, and then it will leave the midbrain and then courses through the cavernous sinus and then the superior orbital fissure and then enters the orbit, and then the fibers for the parasympathetic supply will go to the ciliary ganglion and then they will supply sphincter pupillary muscle and the ciliary muscle. So hope you got the overall picture of the oculomotor nerve now. Now we will divide the oculomotor nerve into various parts depending upon its anatomical location. So first we have the nuclear part, then the vesicular part which is the course of the oculomotor nerve in the midbrain, followed by the basilar part which is the course of the oculomotor nerve between various arteries. Then comes the intracavernous part. After that we have intraorbital part. Okay, so these are the 5 parts of the oculomotor nerve. Now we will discuss each part one by one. As you can see here in this picture, so this is the brainstem which has the midbrain, pons and medulla, and our oculomotor nerve is situated at the level of the midbrain. In the midbrain we have something called as superior colliculus and the inferior colliculus. As you can see in this picture, so this is the superior colliculus and this is the inferior colliculus. So our oculomotor nerve will arise at the level of the superior colliculus. This is the cerebral aqueduct, okay, which is connecting two lateral ventricles with the third ventricle, and oculomotor nerve is situated ventral to this superior colliculus. So hope you got the picture now. In the midbrain, if you take a cut section at this level, at the level of superior colliculus, your oculomotor nerve nucleus is situated just behind the cerebral aqueduct. Okay. So this picture shows the cut section which I was explaining. So this is the cut section which is taken at the level of the superior colliculus. So here you can see this is the cerebral aqueduct. So just behind that we have the nuclear complex of the third nerve. The nucleus of third nerve is not simple. So we have mainly two nucleus here, like we have the Edinger-Westphal nucleus and the proper oculomotor nerve nucleus. This Edinger-Westphal nucleus is also called as accessory oculomotor nerve nucleus. Okay. So again this third nerve nucleus has various subnuclei which are supplying various extraocular muscles. So for the medial rectus, inferior rectus and the inferior oblique muscle, we have paired nucleus on either side. The medial rectus muscle, inferior rectus muscle and the inferior oblique muscle have paired nuclei which will supply the muscles on the same side. That is, they will go to the ipsilateral eye. Okay. Whereas the nuclei for the superior rectus muscle, so this purple thing which is shown, this is which will go and innervate the contralateral, but we have an unpaired nucleus, that is only single nucleus is present for LPS muscle, that is levator palpebrae superioris muscle. So this nucleus will supply the LPS muscle on either side. Understood? So to summarize, we have oculomotor nerve nuclei and the Edinger-Westphal nucleus. Edinger-Westphal nucleus is also called as accessory oculomotor nucleus. So the oculomotor nucleus per se has subnuclei which will supply the various extraocular muscles. For the medial rectus muscle, inferior rectus muscle and the inferior oblique, we have paired nucleus which will supply ipsilateral extraocular muscles. For the superior rectus muscle, we have again paired nucleus but that will supply the contralateral superior rectus muscle. And for the LPS muscle, we have one unpaired or the single nucleus which will supply both the side LPS muscle. From the Edinger-Westphal nucleus, we have the parasympathetic fibers which will join the fibers of the inferior oblique and then take a different path which will relay in the ciliary ganglion and then supply the sphincter pupillary muscle as well as the ciliary muscle. This is one more picture which is showing the nerve rootlets which are coming from various subnuclei of the third cranial nerve and then they will join to form the third nerve trunk. Okay. This picture clearly shows the various subnuclei of the third cranial nerve and how they are supplying the extraocular muscles. So as you can see here these three nuclei which are supplying the medial rectus muscle, inferior rectus muscle and the inferior oblique muscle are supplying the ipsilateral eye muscles. Right? Nucleus for the superior rectus muscle which is situated here is coming and supplying the contralateral superior rectus muscle. And this nucleus, that is the caudal central nucleus of the third nerve, is giving branches to LPS muscle on both the sides. And these nuclei are called by various names. As you can see in this picture, the nucleus which is supplying the inferior rectus is called as dorsal nucleus, and for the inferior oblique it's called as intermediate column of cells. For the medial rectus it's called as ventral nucleus, and for LPS muscle it's called as caudal midline structure. And this is the Edinger-Westphal nucleus which is located dorsal to your main third nerve nucleus. Now moving on to the next part, that is fascicular part. So the fascicular part is nothing but the course of third nerve in the midbrain. Okay. So here as you can see, this is the origin of the third nerve nucleus. So we have the nucleus there. Then it will traverse through the red nucleus and then it traverses near the medial aspect of the cerebral peduncle and then emerges from the midbrain and then passes into the interpeduncular space. This is the course of third nerve in the midbrain which is also called as fascicular part of the third nerve. This picture is showing the exit of third cranial nerve near the medial aspect of the cerebral peduncle. Okay. Then moving on to the third part, that is nothing but the basilar part. The basilar part starts as a series of rootlets that leave the midbrain on the medial aspect of the cerebral peduncle and then they will coalesce to form the main trunk of the third nerve. This third nerve will pass between two major arteries. So the two major arteries here are the posterior cerebral artery and the superior cerebellar artery. Okay. And this nerve travels parallel to the posterior communicating artery as you can see in this picture. So this course of the nerve is called as basilar part of the third nerve. And this part of the third nerve runs in the subarachnoid space. After that, the nerve will enter into the cavernous sinus by piercing the dura just lateral to the posterior clinoid process and then enters into the cavernous sinus. In the cavernous sinus, as you can see in this picture, so once it enters into the cavernous sinus, it runs dorsal to the fourth nerve in the lateral wall of the cavernous sinus. And in the anterior most part of the cavernous sinus, the nerve will divide into the superior branch and the inferior branch. The superior branch is thin compared to the inferior branch of the oculomotor nerve. So once it comes out of the cavernous sinus, it will enter into the superior orbital fissure and supply the various rectus muscles. In the orbit, the superior division will supply the superior rectus muscle, LPS muscle. The inferior division supplies medial rectus muscle, inferior oblique muscle and the inferior rectus muscle. The nerve to the inferior oblique muscle will carry the parasympathetic fibers from Edinger-Westphal nucleus. So that will be relayed in the ciliary ganglion, and then from the ciliary ganglion the branches will arise and supply the sphincter pupillary muscle and the ciliary muscle. So this is the course of third nerve in the orbit. So we have discussed the various parts of the oculomotor nerve, that is from the nuclear complex followed by fascicular part, basilar part, intracavernous part and the intraorbital part. So few words about the pupillomotor fibers. So these pupillomotor nerve fibers are nothing but parasympathetic fibers which are located in the superficial part of, and they derive their blood supply from the pial blood vessels. So as you can see, these are the pial blood vessels. These are the pial blood vessels which will supply the pupillary fibers. Whereas the main interior trunk of the oculomotor nerve is supplied by the vasa vasorum. Okay. And this anatomy becomes important when you want to differentiate between surgical and the medical causes for third cranial nerve palsy. These pial blood vessels are more susceptible for compressive lesions, okay? But these blood vessels, that is vasovasorum, are affected by systemic conditions like hypertension and the diabetes. So whenever there is a compressive lesion, there is pupillary involvement more commonly, and when there is systemic diseases like diabetes and hypertension which is leading to third nerve palsy, the pupil can be spared. This I will discuss in detail when I discuss about the lesions of the third nerve. Just to summarize the various causes of the third cranial nerve palsy depending upon the anatomical position. If the lesion is at the nuclear level, the cause could be either the vascular occlusions or hemorrhage. If it is at the fascicular level, the cause could be metastatic tumors, vascular occlusions, hemorrhages, neoplasms, or the demyelinating diseases. Similarly, if the cause is at the basilar level, you should suspect the aneurysms of the posterior communicating artery, or there can be head trauma. If the lesion is at the intracavernous sinus, the causes can be diabetes or pituitary apoplexy, carotid cavernous fistula, or granulomatous inflammations. When you are suspecting the intraorbital part being affected, then cause can be trauma, neoplasm, or in case of inflammation. This is in brief about the course of the oculomotor nerve. So hope this video is helpful to all of you. If you like my videos, please do subscribe to my channel. Press the bell icon for further notifications. Please do like and share my videos. Thank you so much.